Good morning, everyone. My name is Lorraine Lathan, and I am the director, the very proud director of the Wisconsin African American Tobacco Prevention Network, as well as the Poverty Network. And today we're here for a panel discussion related to health equity, racial equity, and social justice within the arena of tobacco. I thought that it was very fitting to start today because this is the weekend of the MLK Day of Service, which is actually a weekend for us. So I wanted to start with a quote from Dr. Martin Luther King. Injustice anywhere is a threat to justice everywhere. And that's what we're going to be discussing today. But before we get started, wanted to kind of bring people up to speed on a few things. In terms of tobacco disparities within the state of Wisconsin, clearly we see disparities, racial disparities. We know that tobacco does not impact all communities the same way. If you look at this chart, you'll see that the state adult smoking rate is at 16%, and in other populations, it's close to double. So you look at African Americans, you look at multiracial groups, people with lower education, those rates of smoking are much higher, and that is not by happenstance. And then also beware, I look at this in terms of a collision of racism and a number of systems and policies. And so the research is certainly showing us that when you look at health outcomes, it's odd to, well, I wouldn't say odd, but studies are showing that only about 20% of access to quality healthcare actually impacts health outcomes. So it's really those non-health factors that we need to focus on and work upstream, the socioeconomic, physical as well. Within public health, we spend a lot of time focusing on health behaviors, but we have to work, as I said, upstream and look at what are the drivers of those health barriers. Are you living in a food desert? Are you stressed out? Do you have low employment or poor housing? There's so many other factors that we now in public health are forced to focus on. And so when we think about tobacco and social justice, we don't always think about social justice as it relates to tobacco, but certainly these are clear examples of intersectionality as it relates to law enforcement and the enforcement of tobacco policies.
In 2020, the murder of George Floyd by a Minneapolis police officer sparked a movement to address police brutality and other social justice issues. Has that momentum been lost, or is the movement still going strong? Ms. Jones?
Thank you, Edgar. To answer that question, some of the momentum has been lost. I think when terrible things happen, people get energized and everything like that. But policing is a very complex issue. Obviously, you just showed the people that have been how tobacco intersects our lives and how can it intersects when it comes to injustice and policing earlier. But I do think that there is some momentum still left. I think for those of us who are most on the ground, we have not given up, and we won't give up until there are no more deaths at the hands of police.
The key to a lot of this is if you want change in the police department, you have to deal with it locally. So they should have been dealing with the mayor, as we should be dealing with the mayor and common council in Milwaukee. But like many campaigns of this nature, civil rights, it was subverted. People, and I personally blame this on Black folks because I think that we gave the keys to the freedom bus up to so-called progressives and liberals, and they've been dictating who our leaders are, direction of civil rights, diluting certain campaigns, etc. But was the momentum lost? Yes, it was lost, but it will be regained with the next sensationalistic murder. And I hope folks have and woken from their sleep, and will understand how to get change through?
Yeah, so I think the answer to that question depends on who you ask. And so for me and for folk like me, my comrades, other people who call themselves freedom fighters and social justice advocates, the work hasn't diminished. Actually, it's been propelled and it's been mobilized even more. But we're not the mainstream. And so for many others, I think when we're talking about has this changed, the question is, who are we talking about? Has the mainstream, has the power elite, has the white dominant culture reverted back to what it's used to doing? I would say yes, it has. But I think there's a few reasons for that. One is while you're fighting for justice, so we've been fighting for justice for a long time, decades, centuries. People of color, like this it's ingrained in us. We've been doing this for a long time. But many of our systems haven't. Many of our businesses haven't. And so this is a new fight. This is a new discipline for people. And what happened 2 years ago, a whole new field emerged. Everybody's talking about racial equity. Everybody's talking about social justice. Everybody's talking the talk, but people don't know how to walk the walk. And there's a science to walking the walk. There's a practice or a praxis to walking the walk that many people don't know. And if you don't know that, and then you are in a community who doesn't have enough capacity and infrastructure to hold those in power accountable, those who are in those positions of power, those who are in the mainstream or in the elite, they revert back to the status quo because there's nobody holding them accountable. And so for some, it has diminished. For some, it hasn't changed. For me, it hasn't changed. But for many others, yes, it has. And that's because we as a community haven't been able to strengthen ourselves, build our capacity, and organize ourselves to hold them accountable for the change that they say they want to see.
So Milwaukee County is taking key steps to address structural racism as a public health crisis. Have these actions made a difference yet? And how will they improve the quality of life for people of color in the city?
I'm going to answer this question this way. Have they is I would say the wrong word to use. I would say, are they making a difference? And incrementally, yes. So governments, and even like communities, are very, very hard, large systems and institutions to move and change. Even those with the best intention, it just takes time to move and shape and mobilize an organization, a community institution to change. And you can't change overnight. You can't change within a year, 4 years. You can't change within somebody's term. You can't change what funders and foundations say. You have 3 to 5 years to turn this whole issue around. Like that's impractical. That's not how the world works. And inequities and injustice have been pervasive in our communities for generations upon generations. Our leaders, we have a government that have acknowledged the ways and the roles and the way in which we have past and present contributed to the inequities and injustice in our communities. And we are now making the real commitment to doing our part to really address those barriers so that every resident of Milwaukee County can do what I say, reach their full health potential.
Yeah, I mean, and you heard Jeff talk about the steps that they have been taking, and I do think that there are some steps that are being made, but of course we still, I think COVID has really shown that even with those best laid steps that had, declaring racism as a public health issue, COVID has said what really is real. I think we have to actually look at the response to COVID and still the deaths and just the disparities of vaccine. I could keep going on with, and other kinds of things. And I know that that's not all at the Milwaukee County, but just talking about other kinds of things when it comes to structural racism of Black people being healthy and well. One of the things, Jeff talked about that unlearning. I would encourage those who are watching right now, get engaged in the process. If there's something that you do not agree with, or you want to challenge or even ask your your policymakers, whether that's the county executive or that's Jeff or anybody elected, you are a constituent, and this is your government. You have a say so. I mean, I know my Black ancestors had no say so in the structures and systems that were created. I'm living now. I definitely have a say so, and I can be a part of the process and changing it so that it's better for Black folks. And of course, you uplift Black folks, you're going to lift up every other community that's also marginalized. So those are the kinds of things that we have to do. And keep in mind that right now, one of the other things is that would help is if we start really building better relationships. We just cannot expect government official grass tops to do everything. We at the community, the grassroots, we have got to get involved.
Mr. Holt.
Have things changed? Are they changing for the better? I give the county props because I think the county is shouldering more of the responsibility, has more people committed to systemic change. On the flip side, the city is burdened with a lot more in terms of direct access. I always found it bizarre, redundant, hypocritical that a city of the size of Milwaukee, for example, has not had an MBE program for 10 years. And I'm talking about an MBE program with teeth, not the symbolism gold stuff. But we had a city attorney who said it was illegal, and the politicians never really fought that. Matter of fact, if you actually go back, you'll find out that the straw that broke the camel's back was the Hispanic Chamber of Commerce sued the city and said that the MBE program was discriminatory towards them, even though they had a disproportionately high number of contracts. But when I was growing up in Milwaukee, we could not live north of Keith Avenue. People don't know that. There were laws in place that forbid us from moving north of Keith Avenue. And when eventually some of those barriers came down, matter of fact, as a small child, I was participating in open housing marches. And I remember crossing that 16th Street viaduct and being exposed to those signs, those racist signs that told us to go back to Africa, among other things, lynching us, etc. When we finally were able to expand, and I don't think anybody on the panel was just as old as I am, when we were finally able to move north of Keith Avenue, we actually changed the name of Capitol Drive to Blackfish Bay. Lorraine remembers that. But that's the system that's the culture we were living in. We couldn't live there. You couldn't file a complaint against the police department unless you own property, and only 10% of us own property. So there were so many barriers. There was a system of educational apartheid, which unfortunately still exists to this day. I went to Rufus King for 3 years. In my final year, I went to North Division. And fortunately, I had gone to Rufus King because North Division was an antiquated building with ceiling tiles falling around, rats running around the floors. And there was a standing joke. How do you know if somebody went to North Division? Because if you asked them how many states there were, they would say 48. That's how old our history books were. So we are, I can see some of the progress, but the fact that we continue to lead the nation, the United States of America, in 7 negative social indicators as it relates to Black folks speaks volumes about how high of a mountain yet to be climbed.
So communities of color are a key target of the tobacco industry. When compared to Milwaukee's white neighborhoods, tobacco retailers in Milwaukee's black neighborhoods are more likely to sell cheaper tobacco products, advertise menthol outside of the stores, and display cigarettes at child's eye levels. These types of ongoing industry tactics have resulted in tobacco-related disparities. How can Milwaukee address these issues?
It's one of the things that we really need to really address, that we need to make sure that that's not happening, because we know that's not happening in suburban neighborhoods. I mean, I can go in suburban neighborhoods. I don't see that. I mean, frankly, I don't see a liquor store at every corner either in suburban neighborhoods also too. So when we're talking about, where cigarettes are sold, we really need to be looking at the things that make us unhealthy. And these are strategically targeted at Black people. And I'm going to just say it. This is the slow genocide of Black people. Okay, I'm going to say it again. This is the genocide of Black people. Now, maybe it may not be as immediate as police violence is. Obviously, that is an immediate thing.
I agree with you 1000%. One of the things that disturbed me is that now I'm starting to see cigarette advertising in newspapers and magazines again. I thought they had outlawed that, but the Shepherd Express is running cigarette ads. So this beacon of liberalism that's supposed to be leading us to, the mountaintop, they're contributing to the problem. And I agree. I have to admit that the Black press sustained themselves off of tobacco advertising in the 70s, 80s, and 90s. That is a sad reality. The Community Journal ran them, and because the ads were based upon national advertising rates, so you get more for those ads than you get for any local advertising, etc. But one of the things I've noticed, and it's really been surprising to me, is that I'm starting to see a lot of younger people smoking, Black people, particularly Black males smoking, and they grew up knowing the harm.
Yeah, so how can we address the issue in our communities? I think for me, it's about building capacity. When I'm talking about building capacity, I'm talking about 3 specific things: building the leadership, building the organizational, and building the advocacy capacity of residents, so that they have the power and they're empowered to do what we're talking about doing. And our role is to support them so that they can do that. Residents should have the support and have the be empowered to be able to make decisions for what's best for themselves and their communities and their families. And what we can do in Milwaukee is make sure that they have the resources to do that. We need to invest in leveling the playing field in our communities. We need to invest in the communities that have been ravaged by big business and the tobacco industry and the alcohol industry and all those industries. We have to make sure that we're leveling the playing field, investing in those communities so that they are not vulnerable to those forces. And we do that by redistributing resources and power to communities and building their capacity so that they can define what they want and what they need. And I think that government should actually bear a large part of that burden and that responsibility, because societies and communities are built upon, upheld, and in all cases, if not most, if not all cases, are regulated by government.
So many of us here today understand the health toll that menthol tobacco, which has been targeted toward communities of color, Black communities for decades, has had. One recent study quantified menthol as being responsible for 1.5 million life years lost for Black Americans over a 38-year period that ended in 2018. Yet, some still question the need to stop menthol tobacco from being sold in America, with even some Black leaders, some we know that have been swayed by industry dollars, saying it could lead to more harm than good in terms of possible police interactions. What are your reactions to this? And do you believe that a prohibition of menthol is needed in America?
I mean, I think it's true. I think this is the pharmaceutical, the tobacco, they're not doing anything different than anybody else. And so I think that there needs to be more regulation, more laws, more oversight on how they are ravaging communities. And should there be a menthol ban? I don't know what that looks like. I don't know. I think that there should be more regulation though, and there should be more oversight, and there should be more accountability for the businesses that exploit our communities and create the conditions to do that. And I'll say it again, government has to play a more proactive part in making sure that we're holding those businesses accountable, which means that we got to get some folk who who understand what's needed to be in those positions in government, so that governments aren't used as tools. Government is used as a tool for racism and for inequities. Let's be clear about that. We have to have folk within positions of power at the local, at the state, at the federal level who understand that and who are committed to working for dismantling that within the system.
I have no problems with banning menthol. I mean, do we have watermelon flavored cigarettes? Do we have orange flavored cigarettes? I mean, I'm just saying, so why is there a problem with this particular flavor of cigarettes being banned when there aren't any other ones? I mean, I think, is it because, you know, like I said, this is the genocide of Black people, and that and our corporations seeing, well, we know that corporations are seeing Black people as dollar signs to be used and abused. And then, of course, if they're smokers, sometimes they can pass that habit on to their children. I mean, I'm just saying, this is big money, and if we want to interrupt money, we have to come up with some bold ideas. Banning flavored cigarettes is a step. You know, we need to have much more education and things like that, so that children don't get started, you know, on that. And we need to figure out ways. And here's the thing is that also too, talking about cigarettes, are we even really training folks, or because there's so much chaos in our society of how to deal with their issues and problems, so that they don't have to go to cigarettes or alcohol or whatever it is to self-medicate?
I unfortunately am always leery of censorship in any shape, manner, or form, because it often backfires on us. You know, I remember having to testify one time. Well, I was at a public hearing about a proposal to stop the Nazi Party in Milwaukee from distributing hate literature around schools. This was right after desegregation, and the only person who was opposed to it was named Arthur Jones. He was the head of the Nazi Party in Milwaukee. See, again, Lorraine is old enough; she's the only one that knows what we're talking about. So he was there in his full Nazi uniform, etc. And as I was listening to him, and I'm standing in the room as a reporter, you know, and the room was packed. As I'm listening at him, and I'm reading the actual resolution, when he finished speaking, the chair of the committee asked, was there anybody else who would like to speak against the ordinance? And I looked around and shrugged my shoulders and bit my lip and said, me. And I ended up following him, saying that based upon the wording of the actual ordinance, they could ban the community journal because it was any literature that went against, quote unquote, the status quo, but they never just explain what the status quo is. And if you live in the most segregated city in the United States with all these negative social indicators, somebody is dictating what the status quo is. It is not popular to us. So only for that reason, I'm interested, where I'd be hesitant about outlawing menthol. Then plus, you know, you can go to these little stores, which are also popping up quicker than liquor stores, where you can buy these vape pens and stuff, and you can get any flavor you want, including the watermelon.
Thank you. I really appreciate you all today. I'm going to give each of our panelists 1 minute for a brief final statement, and then I'm going to make a few announcements, and then we'll close out. But I'll go ahead and let you go ahead and start with your final statement first, Mr. Holt.
I'm afraid. I really appreciate what Micah's doing. I really appreciate what Jeff is doing. I appreciate what Senator Taylor is doing and what she's attempted to do over the years, shaking the tree. And I think we need more tree shakers right now, because I read a report yesterday that came out, and it was time to coincide with the Martin Luther King holiday. And the report was, which states have made the most racial progress since Martin Luther King's assassination. It was actually 50 states and the District of Columbia. They just included that in there. Guess who was number 50? Wisconsin. Wisconsin. Think about that. You got the mayoral election coming up and all this other kind of stuff. One of the things I learned is, legislation, you cannot legislate attitude. So you're not going to end racism that way. You can deal with some of the effects of it. But we lead the nation, as we did 10 years ago, in 7 negative social indicators. We have the lowest percentage of Black children who could read at proficiency levels in the 4th and 8th grade. My column this week is they're 2 years behind and probably will never catch up because of this perfect storm. We get the highest infant mortality rate, the highest Black male unemployment rate. We're the most segregated city in the United States. We get the widest gap between white, Black academic achievement in the United States of America. There's 7 listed. I can give you 20. I'm somewhat fearful. Maybe we just need to do some self-reflection. I think somebody really needs to shake the tree, because the status quo has not changed the status quo. I'll leave you with this little adage that my wife uses all the time. Think about this. If nothing changes, nothing changes.
Thank you so much. Mr. Roman?
Yeah, I will leave you with this. And when I say it, a lot of people don't agree, but I'm going to say it anyway, because it just is what it is. The burden of eliminating racism, the burden of fixing our communities and improving community conditions, and the burden of keeping our communities and our families well and safe and healthy, it's not the responsibility. Should not fall on the backs of those communities that are surviving within the system. They didn't create those conditions. We're surviving in those conditions. Some of us do well, far more well than others. Many of us don't. But it's not our burden. It's not those communities' burden to fix the things that they did not create. The systems, government, business, all those things, those are who are responsible, who should bear the overwhelming burden of this work, of this task. And until we point our fingers that way, instead of them pointing their fingers this way, we're going to continue to have these conversations and continue to be in here. The burden should not be on the backs of those who are impacted by their oppressed. And until we figure that out and build our capacity to mount a counter campaign against that, we're going to continue to be in these conditions. But I will say this in end, those systems are built by people. Those systems, governments, businesses, are made and upheld by people. And so it takes, to the other panelists' point, you have to do your own work. You have to change your mind, you have to change your heart, and you have to commit to forcing yourself and your sphere of influence to change how they operate so that everything works together.
Yeah, we're at a time where we can change the systems of oppression. I call them systems of oppressions because there's multiple. Racism is by far the greatest, but there's sexism, there's homophobia, transphobia. I could keep going on. All of those things are harming us, and we are not a healthy society. And we really need to do that real deep dive. Those on this call, those watching this, get involved. Get involved. Do not assume that your legislator, I don't care what party it is, shares your values. For one thing, you don't know if you may not know if they completely share their values. And there's always things that go back and forth because, you know, looking at always at the election, vote in every election. We see what's going on in school boards right now about masks and everything like that. And if you care about racism in the schools, you care about all of these things, you care about curriculum, teaching the truth, learning about Black history. Look, American history is Black history. Yep. Okay. Right. So it shouldn't just be once a month. So I'm just saying that there are things that you can do. Do not think that you can't do anything. The change starts within you and how you use your voice, your vote, your time, your talent, your money, all of those things. You have an influence as a person. God works through people. You want to know where God is? God is in you and he's working in you, and he expects you to answer the call to change the systems of oppression. And you're welcome to join us at MICAH or any of our work to do any of that, because we need people so that we can get out of the silos and we can make Milwaukee not the worst for Black people, but we're going to say in 20 years, look what they did in Milwaukee. Look what them folks did in Milwaukee. And we are doing that grounding right now, and you can join us.
We can do it too.
You can do it.